Hello friends, so now in this video we are going to learn some interesting story mnemonics to remember the various diseases, which is autosomal dominant, which is autosomal recessive, X-linked recessive, X-linked dominant, and mitochondrial inheritance. Now you do get a question on that very frequently, though not directly as a one-liner, like in the recent exam, you don't get a lot of one-liner questions. But yes, for example, you can get a question, you can get an image-based question of a patient with a KF ring, and they might ask you what is the inheritance pattern, or they might give you the clinical features of Huntington's chorea, Friedreich's ataxia, myotonic dystrophy, and then they might ask you that what inheritance pattern is it, or in the options you might have which of the following is incorrect, and one option might be related to the inheritance pattern. So this forms an integral part of your syllabus, right? Though it is fact based, but it is very important to remember that. And we know that wherever it's fact based, the mnemonics help you to remember that. So let's learn some interesting story mnemonics to learn these inheritance patterns. So the first one that we have here is autosomal dominant disorders. So this is the list of the disorders which are autosomal dominant. Let's try to remember with the story. So the story here is noonan, one fine noon, two men. You can see the two men here. That is what this will give you a visual memory to remember. Remember this image. One fine noon, two men. Out of that, one man is tall, and he is hatta katta obese man, right? So tall is Marfan, hatta katta is hypercholesterolemia. He is not only round from outside, but he has a lot of round things on the skin inside the body. What are those round things? Neurofibromas. Even the RBCs are round. There are a lot of round colonic polyps, familial adenomatous polyposis. So remember that one fine noon, two men, one fine noon, two men, out of them one who's tall and round, right? Obese and round, inside round, outside. And other man who's wearing a turban and is a dwarf. So tuberous sclerosis is turban and achondroplasia is short stature, that means a dwarf. Right? So both of them are having a fight. They are hunting, that is beating each other. Okay, they are having a fight. You can see this. There's hatta katta man ready to kick this dwarf person. So they are hunting, and what happens in the process is this dwarf person gets a lot of fractures. So multiple fractures, that is osteogenesis imperfecta. His muscles are also injured. There is myotonic dystrophy, right? And these keeps happening in between the two intermittently, right? Beech mein this keeps happening. And finally, who won the fight this time? One is won. Okay, who won the fight? This tall hatta katta person won the fight. So von Willebrand disease, von Hippel-Lindau disease, these are the autosomal dominant, right? And remember that hereditary hemorrhagic telangiectasia is also autosomal dominant. So one trick to remember here for autosomal dominant is, first remember that majority of the diseases where you have the term hereditary or you have the term familial are autosomal dominant. That means it is going from one generation to the other without a skip. There is no skip there. Okay, so hereditary spherocytosis, familial adenomatous polyposis, familial retinoblastoma, hereditary hemorrhagic telangiectasia is autosomal dominant, versus we will see ahead ataxia telangiectasia. Ataxia telangiectasia is autosomal recessive. Hereditary is autosomal dominant, ataxia telangiectasia is autosomal recessive. So I hope this is now easy to remember. So one fine noon, two men, one tall and round person having a fight, hunting with another person wearing turban, a dwarf person. He gets multiple fractures, muscle injury. This keeps happening intermittently. So acute intermittent porphyria. The tall hatta katta person won. So von Willebrand, von Hippel-Lindau, and hereditary hemorrhagic telangiectasia. These disorders are autosomal dominant. Now coming to the story of autosomal recessive disorders. So in autosomal recessive disorders, this is a story of a recessive person. Recessive matlab not dominant, a shy person whose name is Wilson. Okay, so this Wilson once goes to the C side, C sickle cell, C cystic fibrosis. Okay, he is a homo. Okay, he's a homo. What does a homo? Why is he homo? Because he has congenital adrenal hyperplasia. Okay, so you can remember with ambiguous genitalia, this is a cause of ambiguous genitalia. So homo, ambiguous genitalia, they go together. Okay, so a recessive person named Wilson goes to the seaside. He is a homo. Hemochromatosis, hemophilia C. Remember hemophilia C versus hemophilia A and B. They are X-linked recessive. Hemophilia C is autosomal recessive, right? So one day Wilson goes to the seaside. He's a homo. How does he go? He goes in a taxi. Okay, he goes in a taxi. So remember ataxia. That is Friedreich's ataxia and also ataxia telangiectasia. Remember we said it is autosomal recessive. Okay, and there, why does he have ataxia? Because he has spinal muscular atrophy, SMA. Because of that, there is atrophy. Okay, so there he meets an albino. So look at this person here going in a taxi to the seaside. This is Wilson here. Okay, this person here is Wilson and he meets an albino there. Okay, albinism is autosomal recessive. He meets albino at the seaside and suddenly after meeting albino, they both become friends. That is Friedreich's ataxia. He becomes friend and Friedreich ataxia, and this recessive person Wilson suddenly becomes a thalaiva. Okay, he becomes a thalaiva after meeting albino. So remember, albinism is autosomal recessive. So sickle cell thalassemia is autosomal recessive versus G6PD deficiency. Another hemolytic anemia, remember it is X-linked recessive. We are going to see that in X-linked recessive as well. Now the trick for autosomal recessive is, remember that majority of the metabolic disorders, that is the inborn errors of metabolism or the enzyme deficiencies, are autosomal recessive. Structural disorders like the muscular ones like the myotonic dystrophy, osteogenesis imperfecta, bone muscle wale, they are autosomal dominant, while the enzymatic metabolic inborn errors of metabolism are generally autosomal recessive. Okay, so lysosomal storage disorders, they are autosomal recessive, except this sphingolipidosis, which is X-linked recessive. Remember Fabry's. So this you can remember as Fabrics. Remember it as Fabrics. Fabrics helps you to remember that Fabry's is X-linked recessive. Inborn errors of metabolism, including amino acid disorders like albinism, alkaptonuria, phenylketonuria, all of these are amino acid disorders. Albinism is a defect in tyrosine. Alkaptonuria is tyrosine. This is phenylalanine. Glycogen storage disorders we have seen in the video, autosomal recessive. Sphingolipidosis, lysosomal storage, autosomal recessive except Fabry's, and mucopolysaccharidosis except Hunter's. Okay, remember that Hunter goes for hunting and he takes an axe. So remember, Hunter is X-linked recessive. Please do not confuse it with Huntington's chorea. Okay, do not confuse it with Huntington's chorea or Huntington's disease. We saw that in autosomal dominant, two men hunting each other. So Huntington's chorea is autosomal dominant. Hunter's, which is MPS, mucopolysaccharidosis, is X-linked recessive. Okay, very, very important to remember Huntington's and Hunter's. Alpha-1 antitrypsin deficiency, again an enzymatic deficiency. This is related to the development of emphysema, pan-acinar emphysema. This is autosomal recessive. Okay. So remember that for autosomal recessive, it is the story of recessive person Wilson goes to the seaside in a taxi. He's a homo, hemophilia C, hemochromatosis, because he has congenital adrenal hyperplasia. He meets their albino and become friends, and he becomes thalaiva, and the inborn errors of metabolism, enzymatic deficiencies, these are autosomal recessive. Remember, Wilson's is autosomal recessive versus Menkes disease, another copper wala, it is X-linked recessive. Wilson's is autosomal recessive, Menkes is X-linked recessive. You can remember that as Menkes, men have a X factor. Okay, they have X factor. So remember, it is Menkes. This is only for the mnemonics. This is not in reality, right? So this is Menkes is X-linked recessive. Now going to the story of X-linked recessive disorders. So this is another story of X-linked recessive. Now this is the story of a husband and a wife, and the wife having an extramarital affair. So this is Granny. Her name is Granny, having an extramarital with Leshnehan, right? And who's the husband of Granny? Bruton. Okay. So Bruton gets to know about the extramarital of her wife Granny, and he becomes very angry. And the first response, right, we will learn in the personality disorders, the delusions one, we will learn about Othello syndrome, right, infidelity wala. The first reaction of the husband is, oh teri, my wife cheated on me, I trusted her so much. So remember that it is oh teri, so oh teri is OTC. So ornithine transcarbamylase deficiency, which basically comes in your urea cycle disorders. This is X-linked recessive. Okay, so he gets very angry once he gets to know about the extramarital affair. So he drinks whiskey. Whiskey is Wiskott-Aldrich syndrome. He drinks whiskey, Wiskott-Aldrich syndrome. He gets very angry and he's like, ab main isko nahi chodunga, Leshnian ko, I will beat him up. So he takes 6 goons along with him, 6 goons and men along with him, who have the extra X factor. So remember, Menke is the X factor. 6 goons is G6PD deficiency. Okay, 6 goons. So he goes to Leshnehan, and now DMD, the Duchenne's muscular dystrophy. So remember that Dishum is what happens in between the two, and this Leshnehan, his eye becomes black and he becomes color blind. His eye gets injured and he becomes color blind. Okay, so these are the disorders which are X-linked recessive. So what did we learn? Granny, that is chronic granulomatous disease, that is Granny. Leshnehan, Bruton, responses Otheri, he gets angry, drinks whiskey, takes 6 goons, 6 men with X factor, Dishum, color blindness, these are X-linked recessive. Fabry's we have learned, Fabric's sphingolipidosis, this is X-linked recessive. Hunter takes an axe for hunting, it is X-linked recessive. Huntington's autosomal dominant. Okay, so these are the X-linked recessive disorders. Now coming to the X-linked dominant disorders. For X-linked dominant, so remember a dominant female, X-linked dominant, X ke liye female, she drives a car. Okay, a dominant female drives a car. So car stands for Charcot-Marie-Tooth disease, the X type, Alport's, rickets and Rett's. Okay, so Charcot-Marie, Alport's, then you have rickets, the hypophosphatemic rickets and Rett syndrome. Okay, that is X-linked dominant. Now Rett, what is the gene affected in Rett? Remember that in Rett syndrome, it is the females which are affected, and females do a lot of makeup. So makeup gene, that is MECP gene, is what is affected here. Makeup is MECP. Okay, makeup is MECP. So remember, these are X-linked dominant disorders. Coming to mitochondrial inheritance, remember for mitochondrial, M ke aaju baaju wale alphabets is what is the trick for that? KLM, NOP. Okay, these are the mitochondrial disorders. So KLM, NOP. Kearns-Sayre syndrome, Leber's, Lees, Mela's, Murph, NARP, ophthalmoplegia, the chronic progressive external ophthalmoplegia, and Pearson syndrome. So remember, it is KLM-NOP, which is the trick for remembering the KLM-NOP, which are the mitochondrial disorders. Okay, these are the mitochondrial disorders. What does MELA stands for? Mitochondrial encephalopathy, lactic acidosis, and stroke-like episodes. Murph is myoclonic epilepsy with red rugged fibers. NARP is neuropathy, ataxia, and retinitis pigmentosa. Right, so in mitochondrial disorders, the brain is affected, the muscles are affected, right, the nerves are affected, anything which requires a lot of oxygen, they are affected in mitochondrial inheritance. Okay, so these are the mitochondrial disorders. So this is what we have learned here in the disorders. In the another video is where I'll be discussing the dedicated pedigree charts, right? How do you derive whether this is mitochondrial ka pedigree chart, or autosomal dominant, that will be discussed separately in the pedigree charts wala video. Now this is the exhaustive list of all the disorders. Whenever you want to see the extra disorders or whatever disorders we have learned, try to hunt for them in this list here. That's your homework. Like autosomal dominant achondroplasia, that's a dwarf person there, right? Then you have the other disorder that I see here, familial adenomatous, familial hypercholesterolemia, hereditary spherocytosis. This is autosomal dominant. Okay, this is autosomal dominant is what you should know here. This is the list of the autosomal recessive disorders. Okay, this is the list of autosomal recessive disorders. Okay, so I hope you've liked this story mnemonics. If yes, do let me know about that. So thank you so much everyone. After this, do watch the pedigree charts video as well. That's going to help you to integrate that with pedigree charts. Thank you.